NHS bosses in England are warning patients' care could be in jeopardy without a £10 billion cash injection. Two groups representing the health service say the money is needed to cover pandemic-related costs and to reduce the backlog in operations and treatments. The money would be on top of the £140 billion budget already planned by the government. A government spokesperson said, "We are committed to making sure that NHS has everything it needs to continue providing excellent care as we tackle the backlogs that have built up during the pandemic." They go on to say, "We have provided a further £29 billion to support health and care services, including an extra £1 billion to tackle the backlog." The wonderful Dr. Robert Winston is a Professor of Science and Society at Imperial College London and a much-loved guest on this programme. Wonderful to have you on against Robert. Do you agree with these calls? Is that money, do you think, going to be enough?
No, I doubt if it is, to tell you the truth. I think there's a real problem here. And unfortunately, we don't cost, as I said last time, the health service properly. And with the way we've managed the costing makes it very, very difficult to do that because we've divided between the providers and the purchasers so that, in fact, hospitals are charging what they think not what their cost actually costs, but rather what they think providers will pay for the service. And that's a very big problem. They're trying to make a profit, basically, within the health service. It's effectively a private system working in a very strange sort of way. I think it's a real mess, and it really needs to be looked at very, very thoroughly. And, you know, we're talking about a relatively small sum of money because if you remember in the year 2000, when we went to see Tony Blair, we asked him to really do something about the health service and he doubled the amount of money. So he put in something like 30 or 40 billion pounds, which, because we were really concerned the health service was falling behind. And it's that kind of action which is really needed. It's a big, big problem. And I do understand that at the moment the government's very strapped for cash and we don't want to spend more money. But there are two areas in politics which are really important. One is healthcare and one is education, and they're both underfunded.
Do you think, given the chronic undercapacity of the NHS, that just injecting more money is almost like throwing good money after bad?
Yes, I agree with that. I think that's quite right, but that's part of the argument. If you don't really know how much the individual medical treatment costs, for example, if you put it out into the private sector, which is one of the issues that we could do here, you will undoubtedly pay more for it because the private sector will be needing to make a profit because actually it has to answer its shareholders, whereas the NHS shouldn't need to do that. So one of the questions ends up, of course, with this debate that we started to have last time, which is what do you do about possibly privatizing care? Well, it might be better actually to have what's called a hypothecated tax, which is where in fact people pay through the tax system specifically for their health care. But nobody particularly wants to do that because that also raises other political issues as well. So it's a very...
Carry on, sorry.
I'm sorry. Well, the other issue is this, that you know, one of the ridiculous things is that the health service has become a political football, and it's something which all political parties should actually work together to work out, rather than one government trying to compete with another government in the event of an election. That doesn't actually serve the health service well, and it would be much better to see some kind of management which is actually all-party, which is not political, which actually really starts to try to work out what this very, very great need of the nation is and how we deal with it. And that means really looking at its finances much more carefully, like a proper business, which I don't think is really happening.
The pandemic has left this eye-watering, record-breaking backlog in cancelled operations, in once-scheduled appointments. Are we ever going to be able to get through all of those people on waiting lists? Because surely it's going to keep exponentially growing as more and more people have their treatment delayed or start developing illnesses and diseases as a result of not having them treated on time.
Well, you're quite right. I mean, it's very frightening because, of course, we know that when health is left to the end, the treatment is more difficult and the expectation of the health care being able to improve the condition is much less. People will more be likely to die, of course, if their health care is delayed. That's always the problem. That appears to all diseases. And it's particularly true, of course, at the moment. We actually are living in a nation where longevity is actually falling. The government has had this aim to try and increase longevity, which is a mark of healthcare. But actually in Britain, it's falling at the moment. And it's falling partly due to deprivation, but also we're not actually managing to implement healthcare properly. It's a very significant issue.
Do you think, by and large, it's been a bit of a distraction that we're now sort of constantly talking about our NHS and protecting the NHS and applauding the NHS, and that you know, as noble as that is, it's almost sort of covering up criticism of the NHS or critique, let's say, when actually that is desperately needed, possibly a whole root and branch reform?
Well, I think that's possibly the right answer because, you know, we talk the NHS up. We always say that, you know, one or other party is only the only party who really cares about the NHS, which I think is nonsense. We all care about it. But I think this talking up doesn't help, but we waste a massive amount of money. I mean, you mentioned earlier about COVID. Just think about how much, for example, things like track and trace cost, how much it cost us because we didn't, in fact, test for the virus properly. It's not really very expensive to do that. But of course, people paying privately for PCR, for example, are paying far more than the NHS cost, which is a very good indicator of how the private practice element comes in to deal with that. So that the whole thing really is a mess. And I think there needs to be a much more standing back at the moment. And what troubles me very much is something I've said before, which of course is that the health service is now threatened with a new reorganisation before we've really understood what the expense of the health service is going to be, before, in fact, we've dealt with the problems of COVID and the delays. And I think that's a very big issue too.
People who work in public health are projecting we could potentially have a very nasty flu season, potentially as a result of locking down and not really having much of a flu season last winter. Do you think this is going to be a bit of a winter of discontent for the NHS?
Well, I don't know. I'm waiting for my flu jab next week. But of course, as I know, and as everybody should know, that flu jab is not 100% protection. It probably protects you about 50 or 60% of the time, which is certainly better than nothing. And of course, it may be different variants of the flu, because of course all these viruses will have different variances, which may be important. And we don't know really at this stage which will be the predominant cause of the flu necessarily. But having said that, yes, I mean, wintertime is always a particularly hard time. It's not just the flu and the general respiratory infections, but it's much more difficult for old people. It's much more difficult for people who are disadvantaged, who perhaps find it more difficult to travel. And care generally, and especially social care, is one of the major problems facing us at the moment in the country, which is costing, I think, and needs to cost a great deal more.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.